10 seconds.
Good afternoon, and welcome to our daily COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your Plymouth Town Moderator, and we're here this week each day, Tuesday through Thursday at noon for this update, which is number 52, coming to you live on Wednesday, May 27, 2020. This forum is being brought to you live by PAC TV on Comcast, channels 13 and 15, and Verizon, channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. Today, for your questions, please email us to plymouthinfo@pactv.org. These forums can also be replayed at pactv.org/Plymouth. Today, the participants joining Kent Tavares, Matt Muratore, and me include Dr. Mark Wilson. He is a professor emeritus from the University of Michigan School of Public Health, Department of Epidemiology. Also, Michael Jackman. He is on staff with Congressman Bill Keating's office. Heather Cosby. She is a Plymouth CPA. And Bob Nolet. He is the Director of Operations from the Plymouth Area Chamber of Commerce. Each day we date stamp our forum in order that you may know that it is coming to you live. We also bring together officials and experts who are responding to the coronavirus. And we're going to begin today with the chair of the Plymouth Board of Selectmen, Kent Tavares. Ken, welcome back after a one-day hiatus.
Appreciate it to be back, Steve. A couple of brief announcements. I want to let those that follow the town's Facebook page know that we ran into difficulty this past week, but it will be back up by Friday. During the afternoon today, the Plymouth Board of Health is meeting with senior members of the management team to discuss protocols for the beaches. And that, will be certainly an interesting conversation to listen to both the Board of Health and the officials that are responsible for the beaches. Last night, the board had a 2-hour meeting. A great deal of time was spent in going over the budget, fiscal years 20 and 21. We were very pleased to have the chairman of the school committee, Dr. Sorensen, present, as well as our superintendent of schools, Dr. Maestes. It is agreed that the docket item will be placed back on next week's meeting, and we will continue the budget discussions and things that we can or cannot do, or things that we should be considering. Thank you, Steve.
Thank you. And that's Kent Tavares. He is the chair of the Plymouth Board of Selectmen. Each day we begin with a health segment, and over the past couple of months, we've been bringing you information about skilled nursing facilities, assisted living facilities, and even arrangements for funerals. Today we're going to talk about something a little bit different. We're going to talk about what's going on at Beth Israel Deaconess in Plymouth for births. Yesterday our family welcomed a new addition, Stephen Peter Triffletti, who was born yesterday at 4:15 in the afternoon. And he was born by cesarean section, so his mother and father, who are doing well and are with him, are at the hospital, and they're quarantined there for 3 to 4 days. And we grandparents cannot go to the hospital to visit our new grandson, but lots of photos, FaceTime, and videos. So for those of you that may be wondering what's happening locally at the hospital during the coronavirus when it comes to births, there are also new protocols. But we're very happy to report that the hospital is doing a wonderful job of helping with the social distancing and keeping everybody happy. And with that, we're going to move on to the next part of our health segment with Dr. Mark Wilson. Mark, welcome.
Thanks very much, Steve, and congratulations to the new parents. I thought I'd again start with some questions that have arisen during the past week. The first question is, with the opening up that just began in Massachusetts, some people worry that there will be a resurgence of transmission and of new cases. When will we know if this is happening? So my response to that is, except for a sudden increase and a large increase in risky behaviors, people suddenly going to the beaches, going to bars, et cetera, and misbehaving essentially, like we've seen in other states, these changes in the wrong direction should be gradual. Remember that there's an incubation period in which the virus is developing inside people, and it takes a while for it to manifest itself. This is 2 to maybe even 10 days, average of say 5 days or so. And remember also that about 1/3 of infections are asymptomatic, so they're not even counted initially. After that, then there would be a gradual increase in hospitalizations, but this would be a few days later as well. So the idea here is that the resurgence would not be overnight. It would take some time. And so then this is the reason why it's so important that we continue to have monitoring, case reporting, continued testing, and so forth. It's also the reason why contact tracing is still very important, highly recommended. And then isolation might have to take place in some settings. And so it's also the reason why we really need to continue to maintain practices that have been so effective so far, even as the state is opening up. The next question is, what is the situation now in the town of Plymouth? Are we on the right track? The answer is clearly yes, not only in the state, but also in the county and in the town. I thought I'd just share with you some very recent numbers. The county of Plymouth has had 7,600 and some cases. This represents a per capita, per 100,000 population rate of 1,464. As compared with the state's 93,000 plus cases, it's about the same, 1,345 per 100,000. So roughly the same as the average for the whole state. The town of Plymouth actually has done quite a bit better, and there are all sorts of reasons why that may be the case, but we've had only 522 total cases, representing a per capita per 100,000 population rate of only 841, so a little bit more than half of the state average. So this is a good sign. Nevertheless, throughout the state and in most communities, the trend is very good. There's a decline in cases, a decline in all the metrics that we consider important. The state positivity rate is declining. It's now about 8.6%. This is the number of positive cases per test undertaken. And it's actually declined a little bit more in the last few days. This is a 7-day average, the 8.6. So 8% of tests are positive, and that's going down. Remember also, there are many more people infected but without symptoms, yet we're still really far from this herd immunity threshold that we all imagine might be really important. The implications of this are that we have been social distancing. We have been respecting others by using masks and behaving in ways that reduce the risk of transmission. This has been effective. It will continue to be effective. And so let's just keep practicing. The next question is, I've heard talk of the possibility of a second wave of COVID in the US, maybe later this summer or fall. Is this likely, and why or why not? My own view, and this is based on evidence and lots of other people who have thought hard about this and know quite a bit about it, is that the virus is likely to stay in the human population indefinitely. Like many other respiratory viruses in a way. I mean, we have measles, we have mumps, we have smallpox, not smallpox, chickenpox. Smallpox has been eradicated. Chickenpox and so forth. There are many other respiratory viral infections that, despite effective vaccines, these viruses are still found in human populations. My guess is that the COVID-19 virus, which is of course a recent spillover, is likely to remain in the human population indefinitely. It's easily transmitted. All demographic groups are susceptible. Silent transmission is occurring, and it's now spread throughout the world. So all signs are that it will continue to be with us. We're still working on a vaccine, of course, but it's impossible to vaccinate everyone in the world. That will never happen. So it's very likely that this virus will be with us circulating indefinitely. So with regard to the second wave then, or a new spike, what this basically means is a large uptick in the number of new cases. And this might occur if people's behaviors change, if there's less protective measures undertaken. It might occur if there are changes in the survival of the virus. For example, in cooler weather, this has been speculated. If the virus were to evolve, if it's more easily transmitted, or if there's a new strain that's not affected by the vaccine. We can't know for sure, but it's possible and maybe even probable that a second wave, even if it's not a large wave, will occur sometime in the not too distant future. Again, another reason why we should continue surveillance, continue practicing safe practices with regard to transmission. The final question that I wanted to just briefly mention something about today is, why is the vaccine taking so long to produce? Many of you have heard, I'm sure, on various media sources that there are many different approaches to developing a vaccine, and some of these are very new. An estimated 100+ companies globally are working on different kinds of vaccines. And then the eventual approval requires a long series of tests after many different phases of testing. Most of these vaccines are at best in the exploratory and preclinical stages, but there are roughly 10 companies globally that have developed a candidate vaccine, and they're actually starting early phase trials. These are phase 1 clinical trials. Basically, they're small scale trials that assess whether the vaccine is safe in humans and what immune response that vaccine candidate actually evokes. Then there are phase 2 clinical trials. These are larger. They involve efficacy, but also safety, side effects, immune responses, and so forth. And then phase 3 clinical trials that involve large numbers of people, hundreds of thousands even, if possible. And if the vaccine remains safe and efficacious over a fairly reasonable period of time, then the manufacturer is able to apply for regulatory approval and a license. All of this is necessary for approval for the market. Everything is trying to be sped up, as we all know, as quickly as possible. But there's only so much that can be done in such a little amount of time and remain safe. And so everything is being done that's possible, and we should remain hopeful that a vaccine will become available soon. But like everyone else, I'm going to be vague in what soon means. So let me stop there, and I'd be happy to answer questions later on.
Dr. Mark Wilson, he is the Professor Emeritus at University of Michigan School of Public Health, Department of Epidemiology. And each Wednesday, we also welcome Michael Jackman. He is on staff at Congressman Bill Keating's office. Welcome, Mike.
Thank you, Steve, and thank you to PAC TV again for hosting these forums. I just want to take a moment to congratulate you, Steve, and your family. I, too, am anxiously awaiting the birth of a new great niece or great nephew next week. And my niece and her wife are taking all sorts of precautions as well, given the pandemic ongoing. So we'll be very relieved and happy when that occasion happens next week. And I think it's great to follow Dr. Wilson, as always, as we're looking towards a reopening of the economy and of community programs, community life. It's important to keep in mind that the virus is still here, and we have to be mindful of precautions that we need to be taking. I want to talk a little bit about actually 2 bills that the Congress is taking up today, the House is taking up today. Over the last 2 weeks, I've talked about the HEROES Act, which included a lot of provisions, including new funding for economic impact payments, new funding, and new restrictions on the Paycheck Protection Program Act. and funding directly to cities and towns and states. That was passed the House, but the Senate has not taken it up and has indicated that they would not be taking it up. So one of the things that the House has done is to pull out some of the provisions dealing with the Paycheck Protection Program, and they're taking them up today as two standalone bills. One's called the Paycheck Protection Program Flexibility Act, which would address a lot of the things we've talked about on the program over the last couple of weeks. It would allow forgiveness for the PPP loans beyond the 8-week period. Currently, the recipients of the loans would have to spend the money within 8 weeks and would have to spend at least 75% on payroll. It would allow forgiveness beyond the 8 weeks, and would also eliminate that 75% threshold, so that businesses would be able to spend more money on fixed costs like rent, mortgage, utilities, that really are the keystone of what they need to be spending on to stay open and to keep the business alive. It would also eliminate the restrictions that limit loans to 2-year maturity after 9/11 and after the recession 2008. A lot of lodging industry, hospitality, indicated that it took more than 1 season or 2 seasons to recover and to get back to the full revenue amounts that they would see in a normal season. So that's a reflection of that. It would also ensure full access to the payroll tax deferment for businesses that take PPP loans. Both of the PPP and the tax deferment are set up to allow businesses to weather the crisis, and receiving both should not be considered double dipping. So that's another provision. And then last one we talked about as well, there is guidance through the Treasury and through SBA now about this, but this would put it into law. A rehiring safe harbor for businesses unable to rehire within the current deadline of June 30th. We talked about people not being able to rehire, their businesses not being able to rehire their employees because of stay-at-home orders, lack of childcare. This would allow businesses to make a good faith effort to rehire employees and still be eligible for loan forgiveness. The other bill that deals with the PPP loans and the economic injury disaster loans is the Truth Act. It's a transparency provision that would require the SBA to report back to Congress on who received the loans, what lenders made the loans, the number of employees at each entity, demographics on where the loans went in terms of women-owned, veteran-owned businesses, and how the SBA made the decisions. So just a few things that are very likely to pass today and might be looked on more favorably by the Senate. So hopefully they'll provide some relief to businesses that have the PPP loans and are looking at, especially here in Massachusetts, where some of those restrictions are still in place and the phases of reopening are gradual and might be inhibiting businesses from taking advantage of the PPP loans fully. One other thing I wanted to mention about the economic impact payments, stimulus checks, people are calling them the $1,200 checks. We're getting a lot of calls from folks who are receiving the debit card. And I know Heather mentioned these last week. So people are asking whether it's a scam. People are asking whether it's actually their stimulus payment, their economic impact payment. And yes, it is. The IRS is issuing these economic impact payment cards. I'm just reading from the notice here so we can get it accurate. They will arrive in a plain envelope from Money Network Cardholder Services. The card will have a Visa logo on the front, and the back of the card has the name of the issuing bank. The issuing bank is Meta Bank N.A., M-E-T-A Bank N.A. So if you get that, don't throw it away. Don't think it's junk mail. Don't think it's a scam. That's actually your debit, your economic impact payment on a debit card. There's some questions as to why this is being done. And I think Congress will be looking at that again, trying to get some information back from the administration. But if you have any questions, you can go to www.eipcard.com. That'll have more information about what the card is and how you can use it. Or you can always call our office right in Plymouth at 508-746-9000. Thank you, Steve.
Thank you, Michael Jackman. He is on staff at Congressman Bill Keating's office. He and the other members of our panel will be available for your questions. Email us at plymouth.info@pactv.org. And now we're going to go and welcome back one of our other Wednesday guests, Plymouth CPA Heather Cosby. Welcome, Heather.
Thank you, Steve, and congratulations, Grandpa, and send my best to Franklin and your family as well. That's exciting. And thank you, Michael, for that nice recap. I know what I'm going to be talking about next week now, which will be this law passing hopefully today. But yes, there's still been other movements that on some other areas that we've been talking about, so I wanted to recap those. The first one is I still am not hearing the fix related to expenses being deductible or not regarding the PPP funds. So, you know, I know that the AICPA is working hard to make sure that correction is done, or there's a clarifying regulation issued, something so continue to stay tuned. As I've said before, that clarification will significantly impact the amount of taxes you're going to pay this year related to how you use those funds. The next area that I wanted to actually spend some time on, because I haven't, is businesses that did not receive PPP funds. There's relief in the CARES Act for you. We've been really focused on the PPP funds, which I'll come back to, but I wanted to remind you that if you have less than 500 employees, which is almost most of the businesses in Plymouth that I can think of, there are payroll tax credits. There's employee retention credits. These are very good tax credits that are available to you that can cover wages for some of them between March and December of this year. So if you keep watching this and you're going, that's not me, I don't have a PPP loan, but I'm affected. What relief is for me? I recommend that you contact your payroll company because they have all this information. They're the ones that are going to be processing a lot of the credits on the payroll tax forms this quarter and coming quarters. They have a lot of webinars going on. I give a big shout out to the local company, Brabo Payroll, and Kevin Hennessy and his team there, because they have a tremendous amount of information that they're pushing through social media to help all of us here locally and in surrounding areas. So you'll want to make sure that you know there is something that you can also be doing and some benefit that you can get that will help you. The other piece of this that I haven't talked about, which Michael did start to talk about, was the tax deferment. What this is the taxes that are paid, the employer taxes for Social Security and Medicare. There is, under the CARES Act, the ability to have those payments paid out over 2 years, meaning a payment to due December 2021 and December 2022. So, and a lot of people go, well, I don't have payroll, I'm self-employed. It actually does apply to self-employed as well. At the end of the day, you want to make sure you get your tax obligations paid. But if you do see that you need to recover and you need to take advantage of these deferments, you'll want to do that. If you get rocking and rolling, my recommendation to my clients is that you only use it if you need to, and that you know you're going to get the taxes paid. Things like payroll taxes as an employer are considered trustee taxes. Those taxes are not forgivable. And so you really want to understand how you're going to get them paid in the future and not get yourself in the situation where you deferred it because it sounded like a great idea, but then you're stuck and now you have taxes that you can't discharge in court. They have to be paid, and you become personally responsible for those taxes as well. So really understand what you're doing, but it absolutely can be a great way to do some short-term free financing of funds. So for I just wanted to make sure we talked a little bit about that. Coming back to PPP land, what has happened is, and Julie, this is the slide I sent you, is the interim final regulations are posted on SBA's website. This is a 26-page document that is just explaining how the debt forgiveness portion of this program is going to work. I wanted to just put it up. Obviously can't go through the details, so that if you go to sba.gov, that is the document you're looking for. Again, it's 26 pages. It's extremely detailed, and it gives a lot of scenarios, and it explains really well different aspects of this program. So if you're seeking information and you want to educate yourself, I suggest you go and get this document and start to read through it. It's going to give you a lot of fine details about how the program works and how the banks are going to work with you. What documents do you need to support? Things like that. So definitely add that to the list of items that you need to keep yourself educated and make sure that you get these loans forgiven. Within that, I did want to highlight just two areas that I hadn't talked about before. And number one, again, this is about self-employed. So self-employed, they have explained really well how a self-employed person, a person that files a Schedule C, that's a sole proprietor, how your debt forgiveness is going to be calculated, because it's different. Basically, it is the lesser of 8/52, so 8 over 52 of your 2019 self-employment income, or $15,385, which is the $100,000 cap prorated to 8 weeks out of a year. What you really need to understand is that phrase lesser of. So if you got a loan, however it was processed, and say the loan is $25,000, your situation has changed and you're expecting, well, if I pay myself $25,000, I'm going to have that forgiven. No. Say, for example, your loan was, your 2019 taxable income was $50,000. That's half of $15,000. The amount that will be forgiven would be just under $8,000, not the full $15,000 because you didn't make $100,000. So it's very clear how much of yours is going to be forgiven. And you just need to go look at these numbers, pull up your 2019 tax return, your Schedule C, look at the self-employment tax amount you paid self-employment taxes on. That number divided by 52 times 8. That is probably going to be, for a lot of people, lesser than the 15,000, or it's going to be capped at 15,000. So I wanted to make sure everybody who's self-employed understands how the calc works for them. I have had scenarios where the bank forgot to include the self-employed person's income and didn't give them enough funds to begin with. There's just a lot of information was processed very quickly and there's errors in it. So it's really important you understand how much is going to be forgiven. And the other piece, which is a huge part of trying to understand the debt forgiveness loan application, is this concept of full-time equivalence. So in there it says, oh, did your FTEs, they go up or down, or do you have the same number of full-time equivalents? Except they hadn't really defined how do you calculate a full-time equivalent for somebody that works 10 hours a week? So what they have done is they've given a simplified method, which says people that work 40 hours a week, 1 full-time equivalent. Anybody that works less than that is a half-time full equivalent. So that makes it very easy to calculate the full-time equivalent portion of this 11-page loan application that you're expected to pull together, and they didn't really have a lot of definitions before. So just know if you have a lot of part-time employees, each one of them will count as a half full-time equivalent. And I don't see whether or not somebody wants to do the work to calculate actual full-time equivalents, if you have the ability to do that, if for some reason that would work better for you. So I'm hoping to find some more information on that as more of these applications start to be prepared and presented to the banks. I'm guessing there'll be more clarification from SBA, those types of questions. The last thing is, if you're a small business, a lot of the banks that have been issuing these loans are having webinars explaining this. They're having experts on. Definitely seek those webinars. They're free. They want to make sure that you're giving them what they need. Each bank might be slightly different, so look to your bank first. But there's a lot of great information out there, and continue to educate yourself. And apparently every week there's going to be a new law for us to talk about. So thank you.
Thank you, Heather Cosby, Plymouth CPA. Yes, one of the reasons we're doing this is so you can get verified information from experts and officials. And as the coronavirus response in Plymouth continues to change, I will continue to provide you with updated information as we do each and every day in our business segment. And today we have Bob Nolet. He is the Director of Operations, Plymouth Area Chamber of Commerce. Welcome, Bob.
Hey, Steve. Thanks for having me, and congratulations again on being a grandfather. That's great.
Thank you.
So today I just want to talk a little bit from the Chamber of Commerce about our task force, our Plymouth Recovery Task Force that we have established. We are up and running. We meet weekly. And right now it's made up of many different industries throughout the town of Plymouth. And each industry is working on small sub-projects where they're reaching out to their fellow industries, gathering more information. I know Amy has mentioned before, we have survey links out there as well on our website that we really need to gather more feedback, and as much feedback as we can from the local business owners as well as the general public, just to really kind of gain an interest and to see what people's habits will be after, as we start to come out of this pandemic, and what, are people going to be attending, going into restaurants or eating out, or are they going to stick with takeout for a while? So it's really important information that if we can gather it, it'll be helpful for our local business owners. So that task force is also working with Park Plymouth on creating curbside locations throughout the downtown and waterfront areas. This is going to be extremely helpful for the local businesses in restaurants. There'll be dedicated spots located kind of in certain clusters throughout the waterfront that Park Plymouth and the retailers see fit, where there'll be designated signs. It'll be branded as a curbside location, so the public can pull right up. The idea is that they're there no longer than 5 minutes. It's just really for the restaurant owner or the store owner to bring out your orders, your food, your purchases that you might have made online, and then they'll be able to pull right out. So we're going to have a handful of those throughout the downtown area, the waterfront area. They'll all be clearly labeled, and I think it's going to be very helpful for these businesses. As it gets nicer out, we're already seeing, I'm sure on a day like today, the waterfront is packed right now with people just out walking, enjoying the sun, enjoying the open space, hopefully social distancing. But a lot of those parking spots are taken up. So for a retailer that, as it is, they're closed and they only can survive right now, or, will be able to survive off of curbside, it's so important that there's space available for their customers when they need to pick up their items. So that is unfolding as we speak. We're working closely with Park Plymouth and Desmond Egan on this project. And, we can't thank Park Plymouth enough for offering the idea and working with all the local businesses to create this. Also, another thing that the chamber has for local businesses that might be helpful for a lot of people is we have a buddy in business program. It's a mentorship program that we're in our second cohort right now. It actually finishes up a week from tomorrow, and it's a great free program for people that might be looking for new skills or shopping for existing skills, or looking to go a whole different direction in their career, which there could be a lot of that coming up as we kind of come out of this pandemic. People may decide, I either they're not going back to their current job that they were at before this, or they want to kind of go a different direction. The Buddy in Business program is a great way to get in touch with a mentor and kind of have that person that you can share ideas with, bounce ideas off of, and guide you through a slew of different processes. We've had people just work on sharpening their communication skills, and we've also had some coaches, mentors, and mentees working together. Totally changed the mentee's career path altogether. So it's been a very beneficial program. It's completely free. It's offered through the Chamber of Commerce, and our third program is actually going to begin in September. So we have a little bit of time, but it's just something to think about, that if you're looking for that kind of guidance, that buddy in business, that friend, when we come out of this, it's a great program, and all that information can be found right at plymouthchamber.com. And we encourage people to check that out. There'll be more information to come as we get closer. I'm sure Amy will be on here talking about it as well. We really want to get more people involved. It's a great program. We have a great committee behind it. So that's all I have right now. And again, thanks for having me today.
Thank you. Bob Nolet is the Director of Operations, Plymouth Area Chamber of Commerce. Each day we also hear from one of our state representatives, and most of the time it's our Plymouth State Representative, Matthew Muratore. Welcome, Matt.
Hey, Steve. Hey, congratulations again, Grandpa. That's great news. And congratulations to Franklin and his family. It's interesting to hear Bob talk about Amy coming back on. I'm not sure we'll ever see Amy again. I think she's gone national. So Bob, we'll probably see you back again. I really, I love doing all these shows, but I really enjoy the Wednesday show because I become a fan of it. Because I'm affected personally by all this because I'm a small business owner as well. And hearing the updates from Mike Jackman and Heather, and even from Dr. Wilson with regard to the numbers and how they affect my daycare business and when will we be able to open and how does this PPP money going to be able to work? It'll be fantastic if it goes beyond, beyond the 8 weeks, which by the time I open up, that money's gone. I won't be able to use it. So I'm really a big fan of this. I thank you all for what you're doing, the information you are giving out. With that said, I know Dr. Wilson went through the numbers. So what I want to do is just briefly give some of the weighted average that have gone on with these numbers since May 1st. So the 7-day weighted average for positive tests has dropped 70% since May 1st, if you're looking back at that. If you look back just a week ago, it's dropped from 67% to 70%. The 3-day weighted average for hospitalizations a week ago was minus 30%. It was under by 30%. Has now dropped 40%. And the number of hospitalization using surge capacity a week ago was 38%. Has now dropped to below 62%. So you can see that the numbers are really, as Dr. Wilson said, going in the right direction. I believe that Plymouth, we are doing a much better job than many communities. And I think we're listening to the advice of the governor and the administration and the health experts of what we need to do. So I think if we continue this trend, we will, we'll continue to be able to reopen in the phases that we need to reopen. Phase 2 is scheduled to reopen June 8th. And I think if we continue to go by these numbers, we should be able to open up at that point. With regard to the hospitalizations, back on a week ago, the numbers were there were 2,518 folks in the hospital with COVID-19 throughout the Commonwealth. It's down 410 this day, a week later, 2,108. So, and the ICU beds have gone down by 115 from a week ago, from 675 to 560. So we are trending in the right direction. It's great to see that the hospitals are able to take more people, Steve, particularly folks like your family, able to come to the hospitals and not have to worry about having too many folks in the hospital and worry about the COVID-19 as much. BID numbers have dropped significantly as well. They're down to 49 suspected cases or confirmed cases of COVID-19 with only 7 in the ICU. Long-term care still continues to struggle. There are over 47,000 folks who have tested positive, either staff or residents in long-term care facilities. And 61% of all the deaths have come from long-term care facilities, unfortunately. A couple things have come out. The unemployment, as we've talked about, the unemployment numbers in Massachusetts in the month of April was 15%. And it was paid out was $2.3 billion was paid out in 1 month for unemployment in Massachusetts. What the governor came out with today is a program to look at scams and unemployment. So any false unemployment claims using your identity, feel free to call the 877-626-6800 number, or you can go to mass.gov/unemployment-fraud if you've been experienced any fraud with identity theft or with your unemployment. And the final update today I wanted to give is the Registry of Motor Vehicles. We're getting a lot of questions about folks and what's happening with the Registry of Motor Vehicles. Basically, if you have a plate registration or inspection sticker that was due in March, you'll now be due in July. If it was April, you'll be due in August, and in March you'll be due in June. In April, you'll be due in July, and May, you'll be due in August. Same with the commercial driver's license. Those have been pushed off now to September 2020 if you had to renew. And the Real ID program that was supposed to start in October, that's been pushed off till next year. So there is a number of changes with the Registry of Motor Vehicles. People shouldn't worry about if their license are expiring or an inspection sticker is overdue. They shouldn't have to worry about that. Those have been delayed. And if people have questions, they can reach out to myself in my office. We'll be glad to help them out with that. And that's the update for today, Steve.
Thank you, Representative Matthew Muratore. and he'll be here for your questions at PlymouthInfo@pactv.org. We'll also be back again tomorrow, at which time we will welcome Dr. Philip Triffletti. He is an attending physician at Beth Israel Deaconess. Also, Brigitte Keene. She is the chair of the Town of Plymouth Board of Health. Stephen Cole is the executive director for the Plymouth Regional Economic Development Foundation. And I'd also like to report that I've continued to have conversations with the chair of the Board of Selectmen, Kent Tavares, also with Michael Botieri, police chief, and with Brigitte Keene, chair of the Board of Health, as we determine how to move forward with Plymouth's annual and special town meeting. Last Thursday, the Committee of Precinct Chairs met, and at that meeting, I advised them that I will be making a further announcement by next Monday, June 1st. And in the meantime, the Committee of Precinct Chairs is conducting a second survey of all town meeting members in order to determine their current wishes regarding an indoor or outdoor town meeting or a virtual town meeting, and we're still waiting for action on the pending legislation. And with that, we're going to go back to our panel, begin with Dr. Mark Wilson. Dr. Wilson, there has been talk in the media about a second peak or a second wave. Based on the data that you've been reviewing, at least locally for Plymouth or for Massachusetts, what are your thoughts?
Very simply, I think it's too early to know. And part of that has to do with the unknowns around whether or not people will continue to practice social distancing and so forth, even as we open up. Part of it has to do with the role that weather might play in promoting transmission or inhibiting it. And when we say second wave, it could be one that takes place in a month or two or in 6 months. And so I think this is part of the challenge, is continuing to monitor, recognizing that it is, I don't want to say likely, but certainly highly probable. And so given that we know as much as we do now about this virus and its likelihood of being transmitted regularly into the future, we need to be very alert to that possibility and continue monitoring. So it's very, the simple answer is we don't know, but that's all the more reason to pay very close attention.
Thank you. That's Dr. Mark Wilson, Professor Emeritus, University of Michigan School of Public Health, Department of Epidemiology. And these honest, frank answers are very helpful to us all, because as we continue to plan and make decisions, we know that we still don't have all of the information. We're going to continue with our panel. Each day we give them an opportunity to also wrap up a closing statement. We're going to start with Michael Jackman. Mike, what do you want our viewers to remember today?
Well, Steve, thanks again. And as I usually do, I'd like to mention the census. I know that Rep. Muratore and others have mentioned the Plymouth League of Women Voters Community Challenge, I think it's 7 or 8 towns that are in its coverage area, challenging them to have the best response rate per community. Right now, the Massachusetts response rate is 62.2%. The 9th district is pretty low. It's 51.1%. And Plymouth is sort of right in the middle for the towns that are in that area, 63.9%. Part of the issue is that for our district, especially on the Cape and Islands, but also for some parts of Plymouth, a lot of addresses have post office box delivery as opposed to physical delivery to the home. The census counts households, and they count physical households, not people per se. So they can't just send census forms to a PO box. Those homes, those households have to receive the forms physically. The non-response update program, which is the sort of the official name for the census takers who knock on your door and ask you those questions, that process has been delayed until August at the very earliest. But there's another process called the update leave process. The census throughout the years does household canvassing, so they have a pretty good sense of every physical address in the country, really. And for Plymouth, they have a sense of every physical address, and those addresses that have PO boxes don't get mail delivery. They're a part of the Update Leave program. They will be left starting this week. The Update Leave program will be leaving a physical card, letter, some sort of package. If you got a response form in the mail in March or April, this will be similar. It'll allow those people in the Update Leave program to respond. They'll give them an identifying number so they can go online, they can call, they can file the census through that personalized number. US census2020.gov is the website. And you don't have to wait to get that form. You can go online, census2020.gov. You can start the process there. But people should be looking out for the forms to be left at their doorstep if they haven't received it in the mail over the next couple of weeks. So again, any questions about that, census2020.gov, or call our office at 508-746-9000. Thanks, Steve.
Thanks, Mike. Michael Jackman on staff, Congressman Bill Keating's office. We're now going to return to Heather Cosby. Heather, what would you like our people to take away from today's presentation?
Thank you, Steve, and thank you everybody on the show. I absolutely love this Wednesday show. It really helps me actually understand everything that's going on. I have to stop, prepare for it, and be able to explain it to others. So it helps me just as much as it helps everybody else. So I think I just want to visit maybe one or two small things in the CARES Act that, again, haven't gotten a lot of attention. The first one is this idea of net operating losses. And I'm not going to spend a lot of time on it, but I'll probably go through it next week. If you're a business and your business incurred a loss, didn't make income and had a loss in 2018, 19, or 20, there are some very favorable tax rules that I'll go in detail next week about. The second item is charitable deductions. So under the Trump tax law reform, a lot of taxpayers were told that they're not going to itemize their deductions. They're going to take the new expanded standard deduction. But there's this nice item in the CARES Act that says, even if you take a standard deduction, you can deduct up to $300 of charitable deductions right off of something on my screen, above the line on your tax return. So, for example, I say go donate to the Plymouth One Fund, help the businesses. You donate $300 and you are in the 22% bracket on your tax return. That equates to $66 in tax refunds. Go spend the $66 going out to dinner, supporting local businesses. So when you do your work getting ready for your taxes this year, keep all your charitable deductions and give them to your accountant, or remember to use them on your return if you file yourself, because that's a small item that, it adds up. It all adds up. So I can't wait for next week, and I hope everybody has a great week, and thank you to everybody that keeps this all going.
Thank you, Heather Cosby, Plymouth CPA. Bob Nolet, Director of Operations, Plymouth Area Chamber of Commerce. Bob, what's your closing statement?
Thanks for having me today. And I just want to remind everybody that, the task force, the Plymouth Recovery Task Force, is out there working for the local community and the local business community especially. We are out there gathering information. If anyone has any input, feedback, suggestions, please reach out to the Chamber of Commerce, myself, our Executive Director, Amy Maples, or Megan Doherty, with any input that you want us to get to the task force. Everyone's working very hard. We will probably expand the task force as we get closer into the reopening some of the different industries. But right now, we have 15 to 20 different industries represented on this task force, working tirelessly to get as much information together so that we can then present it back to the community as the governor starts releasing a lot of that reopening information. We're going to be able to decipher it and get it out there. The chamber is also working on a comprehensive list of chamber members that are offering PPE supplies. So that'll be helpful for businesses that when they need to reopen, we'll have a list of businesses that they can purchase bulk masks, gloves, hand sanitizers, plexiglass coverings that they may potentially need, as well as members that offer deep cleaning services that can come in, once or twice a week and really sanitize your office space. So we're currently working on that list that we will be sharing out shortly. That should be helpful for a lot of the local businesses. I think that's all I have for today.
Thank you, Bob Nolet, Director of Operations, Plymouth Area Chamber of Commerce. We'll now go back to Dr. Mark Wilson. Mark, what would be a takeaway today that you'd like our viewers to remember?
Well, with the announcement of the birth of a new Triffletti, I was reminded that we shouldn't think of children as immune to infection, and that they should really be part of our joint community efforts to reduce COVID risk. And so even if they are less likely to have severe disease, children can play an important role in transmitting to others, and sometimes they do so silently. So we want to be sure that parents and teachers and all family members continue to encourage children to practice safe social interactions and physical distancing.
Thank you, Dr. Mark Wilson. He is Professor Emeritus, University of Michigan. Now we're going to go to Plymouth Representative Matthew Muratore. Matt, what do you have today for us as a closing statement?
Steve, it just reminds me today about what a great community we actually live in and work in. Seeing the chamber, how proactive they've been through this whole ordeal. It's wonderful to see what they're doing, how they're working with organizations like Park Plymouth. They're working with the restaurants and other businesses, and now they're going to put out PPE information. It's just, you don't see this around everywhere. So, and having the experts on that we have on like we do today, it's just really helpful, and it really makes our community a very special place. I'm so proud to represent. I just want to remind people again that just continue to stay informed. By going to mass.gov/COVID-19. If you have questions, call 211. If you want text alerts, go to text COVID MA to 888-777, or in Spanish, COVID MA ESP 888-777. Or if you have questions on your health, bowie.com/mass. Continue to follow the advice by the public health experts, as well as the governor and the reopening advisory board for businesses that are opening, that will be opening. If we continue to follow those advice by basic things, wearing masks and social distancing, we will continue to get through this, and we'll continue to see the reopening of our Commonwealth. Again, there's a lot of heroes out there, and I don't want to forget the heroes that work in long-term care facilities. They have a special place in my heart, and I know other people as well. Over the years, nursing facilities, assisted livings, and rest homes have got sort of a bad rap over the years for what they do. But they're really seen now as heroes of what they're doing. They're running into danger every single day, caring for people that we can't care for. And we got to be very blunt about that. People are in these places because we as loved ones are not able to do that. So we really should be proud of people that are working in these facilities and call them heroes just as much as we do the doctors and nurses that actually work in our hospitals and healthcare industry. They all should be, they're all heroes to all of us, and we need to look at them all that way. We thank them for taking care of our physical health, all of them. And of course, those that are working in businesses, thank them for taking care of our economic health as well. And again, the more we can come together by staying apart, the faster we'll the people we love and the things that we love to do. So we'll see you tomorrow, Steve.
Thank you. That's Plymouth Representative Matthew Muratore. Thanks to all the members of our panel today, including Dr. Mark Wilson, Michael Jackman, Heather Cosby, Bob Nolet, and now we return to the chair of the Plymouth Board of Selectmen, Kent Tavares. Ken, what do you have for us today?
Well, first and foremost, Steve, welcome to the Grandparent Club. It's the best happiness in the world is to be a grandparent, and congratulations to your family and to Franklin and his wife and the new Triffletti. I couldn't help but chuckle when Matt Muratore was giving us advice on the registry. I'm glad that we went to the inspection station today, Matt, because we're actually a couple of months behind and didn't realize it until it was pointed out to us this week by our son. So to err is human. I also want to include my appreciation to the chamber. I've had numerous conversations with Amy. The task force is doing a phenomenal job, and it's just great to have that input for the total community which they are serving. So thank you, to the chamber. As Dr. Wilson has pointed out, there's good news, and it's coming. There's good weather, and it's here. But we still have to follow the protocols, and I think it's so easy to forget when you're feeling good. So my last words to you for today are: be happy, but be careful. We still are waging this battle, but we're gaining on it. So, thank you, Steve.
Thank you, Kenneth Tavares, Chair of the Plymouth Board of Selectmen. Tomorrow we'll be joined by Dr. Philip Triffletti. He is an attending physician at Beth Israel Deaconess. Also, Brigitte Keene. She is the Chair of the Plymouth Board of Health. Also, Stephen Cole. He is the Executive Director, Plymouth Regional Economic Foundation. And they will all be joining Ken, Matt, and me at 12 noon. I'm Steve Triffletti, Plymouth Town Moderator. Thank you for joining us, and good day.